Hey guys, this is Dr. Hub. Today we'll look at the endometrial cancer management. So in this, the surgery is done for the staging of this cancer, and surgery done for the purpose is the abdominal hysterectomy. So there is the abdominal hysterectomy, and there is also the bilateral salpingo-oophorectomy. Bilateral salpingo-oophorectomy. Salpingo-oophorectomy. Then comes the presence of the omentectomy, as well as the pelvic. Then there is the para-aortic lymph node sampling as well. Para-aortic lymph node sampling as well. So now we'll be seeing the stages. That is, in case of stage 1A, 1A stands for it is non-invasive. Non-invasive is nothing but stage 1A. And what is the treatment? Treatment is just surgery alone. Next we move on to the type 1A. So previously it was type 1A invasive, and this is type 1A. Type 1A is nothing but surgery, and there is the post-op radiotherapy. Then moving on to 1B. 1B, there is surgery as well as the post-op pelvic radiotherapy, and this is about 4,000 to 5,000 units. Next is the post-op vaginal vault radiotherapy. So in 1B, there is post-op vaginal RT, that is radiotherapy. Next we have the 2. In terms of 2, it is nothing but the surgery, and there is the post-op brachytherapy. So there is post-op BT, that is nothing but the brachytherapy. Next in line, there is the post-op external beam radiotherapy. Post-op external beam radiotherapy. Next is the presence of the Wertheim's hysterectomy. Wertheim's hysterectomy. Next we are looking at the type 3. So in case of type 3, it is inoperable or the cytoreduction. It is inoperable, and there is the cytoreduction. There can be chemotherapy. So the chemotherapy along with the doxorubicin, and there is cisplatin. Then there is a paclitaxel. Next is the medroxyprogesterone adjuvant. Now looking at the type 4. The type 4 is inoperable. And there is cytoreduction. There is a palliative radiotherapy, and there is chemotherapy. Next is the progesterone therapy.